This is PopHealth Week, streaming live on Healthcare Now Radio. I'm Gregg Masters, your co-host and executive producer. Joining me in the virtual studio is partner and co-founder Fred Goldstein, lead host and president at Accountable Health, LLC. PopHealth Week is your destination for unfiltered conversations with visionaries driving population health forward. Whether you're a payer, provider, patient vendor, or policymaker, this is your go-to hub for fresh strategies and insights into population health best practices. Want to stay connected? Visit popupstudio.productions or message me on Twitter via @GreggMastersMPH, and that's Gregg with 2 G's. And follow us at PopHealth Week. To reach Fred direct, visit accountablehealthllc.com. Today, our guest is Pravin Pant, Vice President, Advanced Analytics at ZeOmega. Pravin leads ZeOmega's Advanced Analytics team in working on new and existing AI solutions and social determinants of health solutions. An experienced executive leader with a demonstrated history of successfully working in the hospital health plan industry for over 20 years, he is deeply proficient in team building, leadership, innovation, artificial intelligence, big data, predictive analytics, and population health management. Fred, the mic is yours.
Thanks, Gregg. On today's episode, my guest is Pravin Pant, Vice President, Advanced Analytics at ZeOmega. Welcome, Pravin.
Good morning, Fred. Nice to be here.
It's a pleasure to get you on. Very excited after our initial conversation. So why don't we start? Give us a little sense of your background in the company.
Sure, great. Again, my name is Pravin Pant. I'm the Vice President of Advanced Analytics. I've been with ZeOmega for a little over 6 years now, and then before, within the healthcare domain for almost 23 years. So I've spent a lot of time within the provider side of the house, and now for a very long time in the payer side of the house as well. So I have always been in healthcare throughout my whole career. And again, with ZeOmega, I started as senior director, leading this whole similar analytics and AI space. And then now I'm the vice president for the last almost 3.5, 4 years. So glad to be here.
That's excellent. So give us a little sense of ZeOmega. What do they do?
Great. I mean, again, ZeOmega, we're a leading provider of population health management solutions. We're primarily serving healthcare organizations such as payers and providers. And we have a flagship platform, which is called Jiva, which is designed to basically integrate data from multiple sources, and then provide analytics-driven insights and enable care coordination to improve patient outcomes and reduce costs. So that's what we have. We also have, the other very important aspect of the product that we have is also on the utilization management side, which is our flagship product, which is also, again, we are class number 1 right now. For the last 4 years, we have been best in class. And so it's basically we are a AI-driven population health management product that's really out there to help members and our clients to do a better job to improve patient outcomes, save lives, and also build that efficiency.
So let's dig a little bit into the population health portion first.
Sure.
What sort of data do you ingest and bring into that platform?
So, there are a wide variety of data we bring into the platform, right? So what Jiva does is Jiva helps healthcare organization manage patient population. So we consolidate clinical data, claims data, social determinants of health data. We also, can have the capability to bring the wearable devices data, which now is very important because that, especially if we're doing the population health management, right, we have that capability. And in order to support this, we have a different ways to bring the data through our, the customized APIs, standard APIs, even the smart on fire technology, CCDAs, and things of that, different integration capabilities. So these are the ways we bring different data into the platform so that we can build that cohort population and really understand what that population looks like.
Mm-hmm. And so you integrate claims and as well as the clinical data, which is important. Often groups only have one or the other, depending on where they sit in the healthcare spectrum.
Right. It is important because, unless you have the variety of data, you're not really able to understand the whole picture of the individual or the population. So that's why we always make sure that, like we have variety of different. And then again, clinical data is very critical, right? Clinical data is critical. Claims is also very critical. Social determinants of health data is extremely critical as well. And like I said, wearable devices data is also now really, really important because if you think about it, if for your emerging risk population, like let's say a care manager is, working on like a cohort of population, he or she needs to really understand what is happening with that population as well as an individual number, not what they see, but also what are different insights coming. So in order for you to be able to really understand the like the whole spectrum, you need to have all these data. Then only you'll be able to really understand what's going on. Whether somebody's, you're looking at a member, let's say you're a cohort of population that with high blood pressure and certain different, like chronic conditions, but then having all these data, you'll, feed insights to saying that, hey, there might be a possibility of hospital readmission. There might be a diabetes, readmission here. There might be an opioid risk here. I mean, all those different insights will come at play so the care managers can now build and automate the next action based on the recommendations.
Yeah, you talked about population health and also mentioned the individual because obviously to move a population, you change it one person at a time. And that
Right.
means you got to understand them. And one of the areas that sort of fascinated me is you talked about integrating social determinants of health data. Obviously,
Mhm.
everybody talks about this, but give us a little bit of insights into what you're bringing in and then how you use that.
Sure. Like, so what we're doing at ZeOmega from the social determinants of health perspective is the two things we're doing. One is we're really trying to understand the community where a member is, because that's critical. So, in order for us to really understand what is happening with the community, we are looking at various different data points from, like different publicly available US government databases at the census tract level. So we are looking at, I think there are 6 or 7 different domains we're looking at, like, for example, food, housing, transportation, education, employment, income. And then, we're looking at all this different data at the community level, meaning where the person lives, how does that, all those information when put together, how does the social index looks like for that individual in that area. So we're able to do that. We have our um, proprietary algorithm we built in-house. So we actually take all that data, we build certain scores, and we assign the score to each census tract in the United States. So, and then now we take the population and we put the population in there, and then we're able to see, oh, you know what? Here, education looks fine, income looks fine, but then transportation looks really bad. So we're able to understand that. And that to me is a probability. There's a probability that the person, because he lives in this area, might have that issue. Then what we do is, like, based on those, we use our artificial intelligence to really say that, okay, how well is that really an issue within an individual? So we send out assessments, we send out different things to get validation back, because once we get the validation back, then we know that what we see, at the community level is truly a validated risk. And then we automate the action on that. So basically, what we're doing, Fred, is we're looking all this community level data, we're building insights. That insights is now, you know, given, like, this insights will actually give you the various aspect of what needs to be done. From insights, we're driving the action. you know okay, these are things happening, we're validated this, yes, these are the things we need to help, this member needs help, or this population needs help. And I'll give an example here shortly as well. And after that, it automates the action, the workflow action, that what needs to be done. And then we're also able to measure that. So what we do is, like, okay, for this cohort of people, where we, like, there are, let's say there were 1,000 of them. Out of 1,000, we took actions in 500, and we did not take actions in 500. Then we'll do a pre and post. Let's understand the pre clinical quality measures on these members, like, their ADK, BDK, their, ED admissions, their medication adherence. We look at all that, the important things that, very critical in value-based care, right? And we see, okay, where were they? Well, we'll see a trend, we'll understand how things were. Then we will also look at, so for the people we took actions on, like for example, there was a transportation need or there was a housing food need, we took action on those. And what did that population look like now? How does their quality measures look compared to, like pre? Then we also look at the ones that we did not take action on. Same cohort with the same issues, but we did not take action on. What does that look like? And then this really gives you a visibility into whether some of the things you're doing are really working or not, what programs you need to really kind of like tweak, what programs you may need to introduce, and things of the nature. So I'll give you a classic example here. So in one of my experience working with a client around Virginia, they were saying to me that, hey, we've invested so much of resources and then so much of basically a financial cost to really help this area around Roanoke, but that still didn't help. Then I said, yeah, let me look into your existing, like population. So what I did was I took their population, I really looked at the census tract level. So what I found out was after 15, census tracts, only three of them were severely in need of SDOH. They were like severely high risk SDOH areas. So anybody that's living in that particular areas needed more help. So the other like 11 or 12 of them were okay. What the organization was doing was they were equally distributing their resources and their needs across the whole area, not knowing that those three were the very highly critical areas, right? So now what they are able to do is they're able to bring back some of the resources that they were like spreading somewhere else into and focus into that very needed area. As a result, they're able to make changes. They're able to actually make things better for that population.
Hmm.
So not only this, right, injecting this, having visibility into different data and building this data into your AI models, into SDoH will also help you understand what actions might be there that you can take for the community. For example, if you see a community risk, like a high risk SDoH community, then you also understand that, oh, there are also certain chronic conditions happening within that because you layer on top of that you are now able to say that, you know what, I might as well send some mobile clinic there for a day or two to
Hmm.
get, everybody's blood sugar tested because so you are able to build programs and interventions at a population level as well. It actually tells you how things or what things should be done.
Hmm.
So it's a very interesting like time and then the having data to do these things within the STO, which is amazing.
Yeah, really, really interesting. And I want to get back to a point you touched on. You automated the process to validate that the individual is experiencing that particular social determinant of health issue.
Correct. That is correct. So without having a validation of that, we are not really 100% sure.
Well, excuse me, I'm laughing a little bit because I often see, hey, they live in zip code XYZ. That is a zip code that is experiencing this. So they must be experiencing this. But unless you validate it, like you said, you're going to be much less efficient.
Correct. So once you validate, then because I may see a transportation issue in that area, but that individual may be living with somebody else who can provide transportation for them, right?
Right, right.
So there is a way that I have to make sure that I validate. So the other thing is like I may say, oh, food insecurity. Unless I validate, I'm not going to know whether it's a food, like food insecurity related to affordability or it's more like literacy because there's a two
Hmm.
different things.
Correct.
So, because I want to be able to give a precise, like a next action. So that will help me do that.
Just tuning in, we're here with Pravin Pant, Vice President, Advanced Analytics at ZeOmega. We're talking about AI applications in the social determinants of health space and its impact on population-based metrics. Stick around, you won't want to miss the rest of the story.
So
Go
on the
ahead.
flip side, you have what appears to be a fairly wealthier community or a community less in need.
Uh-huh.
Do you then go back in and validate and attempt to identify the individuals in that community who may be
Well,
living under those types of conditions or things?
yeah, I mean, it depends, right? In that area, absolutely, because it goes that, like there the situations might be different. You may not, there might be, hey, there could be the educational barrier might be very less there, right? The income might be high. So, there are a lot of things that could be afforded, but there might be educational information that still may not be making to everybody because not everybody knows how to do certain things the right way. We're
Hmm.
always constantly looking, right? Today
Correct.
in social media, I look at things, oh, you know what? If I do this, it's going to help with my blood sugar. I mean, so those are important. You may not need to give them a financial help or, but there might be a need for educational help as well. So we look at different data points. That's why we look at the age group. We look at the, how, and again, one of the key thing here is also social isolation. If you want to really understand how this population looks like, are they more on the retired side? I mean, there are a lot of different things we bring into perspective to really come up with what information should we be giving to this cohort, like, in a rich neighborhood or whatever that is, right? So I think the information is needed everywhere.
Yeah, it's interesting that you mentioned social isolation as well, because I recall a few years ago going to a Humana Bold Goal presentation where they listed the number one indicator was loneliness,
Absolutely. It
that was
is. It is.
driving. And if they began to focus on that, they knew that population needed considerable help. So you
Absolutely.
mentioned AI. Um, a lot of people talk about they've got AI in their system or they've developed algorithms, and then you look behind the cover and there's 1,000 SQL queries back there, and they've told you they've got AI. So tell me a little bit about what your AI is and what you're doing with it.
So, like what we have done is, we've integrated our artificial intelligence into our healthcare solution, obviously, to enhance the population health management. So the whole idea behind our AI tool is to improve the patient outcome, reduce cost, and then optimize, basically operational efficiency, right? So there are two ways, Fred, we're utilizing our artificial intelligence. One within our care management space, which is includes of your case management and your disease management, right? So AI there is more like, to give you insights into some of the emerging risks besides what you're looking at. So as a care manager, you're looking at a diabetic population, and then you zoom into an individual, then you realize that this person also, because of AI, now we're giving insights saying that, hey, there might be a readmission, happening here within the next certain time. There might be a probability of that. There might be a probability of opioid risk. There might be a probability of different things. So we look at so what we do is like our AI is more focused on emerging risk into readmissions, ED visits, lowering the ED visits, medication, and things of that nature. So that's one area we utilize. The other area where we built our AI is on what we call is smart auth AI for utilization management. So the whole idea of this AI is to address the challenges of the prior authorization, which is used, right, process. So we now have developed and deployed what we call a smart authorization AI. This solution basically automates and accelerates your prior authorization for procedures of medications, and then it helps you reduce administrative burdens and expedite the patient care. So and then the question you said about, I think one of the things you just mentioned earlier is about it's a bunch of, queries, right?
Yeah.
That's different in our case because we have access to almost, 13% of the US population, pretty close to 13%. So whenever we build this AI, we're actually building it based on the data that our clients have shared with us. So for example, our Smart Auth AI got built on over 10 million authorizations and with more than 200 data points and these are not synthetic data. These are all real data. And as a result, we were able to, predict 80% of the manual authorizations with over 95% accuracy.
Wow.
So we just in first year, one of our clients were able to save almost 8% of their total administrative cost. That's only in 1 year, and that's only because they were very conservative. They only wanted to automate up to 20%. Now, if they're looking at, it's in millions of dollars of savings, right? So next year they may even say, hey, you know what? We want to bump it 40%, so that millions would go double. So we do not have any SQL queries. We really have the artificial intelligence. We have a
Hmm.
whole team dedicated for artificial intelligence. We also have a lot of work within the Gen AI space. So, we do utilize OpenAI algorithms. And again, it's critical, right? Whenever care manager is having a conversation with the member, Gen AI is going to be able to tell you what are some of the things you should really think about, focus on, because it's already looking at all that information and telling you this might work better for this individual, this route might be better. And to be honest with you, when you have that kind of information ahead of you, like, in front of you, not ahead of you, in front of you, and you're able to take that and communicate that to the client, it's going to resonate.
Right.
The member will be like, that makes sense. That really aligns with what I'm thinking, right?
Hmm.
So we're also bringing that capability into our platform as
Hmm.
well. So there are a lot of things we're doing, and I'm excited because I get to be part of this. So
Right. Right. And when you talk about this AI, you were talking about it in particular in use of claims. Obviously, there's been some real issues recently in the press about claims and AI being used against claims. And so what your process is doing is, it sounds like, is in essence saying, hey, these all meet the requirements. You can push these through quickly to allow the individuals to then focus on those that might be problematic versus, hey, we're just going to deny this.
so yes, I mean, great point. We are not doing AI for denials. Our AI is not for denial. Our AI is to expedite your approving process. So we call it Smart Auth AI for approving. So I'll give you an example. Let's say if you have like certain medical policies in house, and if a procedure or authorizations come through, it matches that everything in line, hey, matches everything, has everything, auto approved, right? But there might be a situation when it might be missing certain things, or the criteria might be a little bit not met, and then it goes into the manual review.
Hmm.
So before it hits the manual review, now our AI takes over. It actually goes through our AI, and AI will predict and give you, hey, these are the reasons you should go ahead and approve them, because based on the past historical thing, this situation has always resulted in approval. And as a matter of fact, if you do, then it also shows you what would be the cost savings for you to approve today versus going through the manual process and
Hmm.
all that. How much it's going to cost and how much savings you can truly have. So think about it, right? Anything that's coming into the organization like 10 or 15,000 times a year, and if all of have to go through manual review, just look at the cost.
So you actually put the cost up of the time of that person taking to do the review to show
Correct.
them, hey, this should go through, but if you choose not to, here's what you're going to pay.
Correct. We have
That's
a analytics dashboard that actually looks at the procedure levels, line of business, and tells you how many times that procedure has come through, what is like, the dollar value associated. I mean, it gives you a visibility, a complete visibility into everything we'll be doing. And as a result, your clinicians now can understand why, yeah, that makes sense to approve.
hmm. And you talked about emerging risk, which is really a fascinating topic because you oftentimes hear plans say, "I'm going to focus on my top 5%, or I'm going to focus on my top 10% of costs." And you begin to factor in regression to the mean, and suddenly people are getting healthier. And then but you have this whole rising or emerging risk. So, do you see that most of your clients are saying, "Boy, that's an important area for me to consider"? Have they gotten there?
I have seen, like there is a shift. There is a shift for sure. Like, I think they're all now understanding that keeping people healthy will, here's the thing, right? I see this as a bucket full of, like a lot of, like a population that has a lot of chronic conditions, right?
Hmm.
And then today you're focused on that. And then let's say you are able to help and empty that bucket. But if you're not focused on the emerging risk, a lot of people will fall into that bucket again, and your bucket is full.
Right.
So you will never be able to finish that. So focusing on emerging risk will actually help you build that wall so that your bucket, once empty, will stay empty, right?
Very true. Yeah.
So that's what I think a lot of the clients, I mean, this whole person care, social determinants of health, all of these are now helping them understand that we should be focused on emerging risk. and not really just focus on the bucket that for top 5% or 3% where we're spending a lot of money. Because if we're able to stop people from coming into that 3%, that is the true savings. And then health can truly can make a lot of money then, right?
Sure.
So, and then this is doable. Like, if again, coming back to the care managers, the AI, right? This is possible when you have visibility into many things that might be happening while you're working on an individual, right?
Hmm.
Somebody gets discharged from the hospital, that person goes into the rehab where the case manager now contacts the person in the rehab and trying to avoid them from readmission, but then also realizes that AI is giving them insight on 5 other things that they can work on so that even after they're done, they will be truly healthy. So
Hmm.
that's the vision I have within our platform. And that's what we are focused at. It's not just one on one, but you should have visibility into many things. And then the generative AI should take all that and also recommend what is the best path forward for this individual, and give that recommendation to you so that you as a care manager can have a proper discussion with the individual and then, have that person in a journey. So that's how I see all this connected.
So we've got about a minute left, Praveen. Can you touch a little bit on where you think AI is going and what excites you?
Absolutely. I think AI is going, again, AI is already here. AI is going to focus more on automation, so Gen AI will be part of this. So what really will happen is AI will not only build you the cohort of population, but it will also give you all the insights and also will give you the recommendation on what should be done and how should be done so that every member can be satisfied because that customization will be built for that member, right? So as a result, you will see an improved patient outcome, satisfied member, as well as satisfied providers, as well as the friction between payer and providers will be very low because of everything automated. And as a result, there will be a great ROI from the financial perspective as well by making the patient's outcome better.
Well, that's a great way to finish up the show, Praveen. Thank you so much for joining us.
Thank you. Thanks a lot. Great to be here.
And back to you, Gregg.
And that, dear listeners, is a wrap for today's episode. A big thank you to our global audience for tuning in, and an extra special thank you to Pravin Pant, Vice President, Advanced Analytics at ZeOmega, for his insights today. To learn more about Pravin's work at ZeOmega, visit zeomega.com and follow on social via @ZeOmega and LinkedIn. If PopHealth Week resonates with you, we'd love your support. Give us a thumbs up on your favorite podcast platform. Share it with your network and do subscribe to ensure you never miss an episode. We're live on Healthcare Now Radio every weekday, 5:30 a.m., 1:30 p.m., and 9:30 p.m. Eastern. On behalf of Fred Goldstein, myself, and the crew at Healthcare Now Radio, stay safe, stay tuned, and we'll catch you next time.